How are you?
Good.
My name's Caleb. I'm going to be your nurse today.
Okay.
I'm going to perform a head-to-toe assessment on you, which means I may have to feel around your body just to examine those body sites and stuff. Okay, do I have your permission?
Yes.
Okay. Can you tell me name and date of birth?
Keith Williamson, March 3rd, 1990.
Okay, good. I'm going to perform hand hygiene and draw the curtains to ensure your privacy. Alrighty. So, patient, can I see your arms? Patient's skin is warm, dry, hair is evenly distributed throughout the arms. Fingernails are rounded and well taken care of. No clubbing indicating lack of oxygen, and skin turgor is good, indicating no dehydration. Patient is well kempt overall, dressed for the situation or the occasion. Hair is sandy blonde, and patient's affect is pleasant. Patient is erect. Okay. So the first thing I want to do, Keith, is I'm going to have you close your eyes,
Okay.
and I'm going to have you smell this. I'm going to put it beneath your nose. I want you to just tell me what it is.
No.
Okay, good. Cranial nerve number 1 is intact. All right, the next thing I want you to do is cover one of your eyes. And I'm going to just hold up 1 or 2 fingers up beneath, above, and to the side of your eyes. I want you to tell me what it is, okay?
2.
Okay.
1. 2.
Good. This side.
2. 1. 2.
Good. Okay. So I want you to cover your eye again, and I'm going to check your peripheral vision, okay? So just tell me whenever you see my pen.
No.
Okay, good.
No. No.
Good. Other side.
No.
Okay.
No.
Good.
No.
Cranial nerves number 2 are intact. All right, next thing I want you to do is just focus on my pen light and just follow with your eyes, not your head. Ready? Okay. And now I want to shine a light in your eyes just to see how your pupils constrict. Good. Pupils are equal, round, and reactive to light and accommodation, and cranial nerves 3, 4, and 6 are intact. So for the next nerve test, I'm just going to provide resistance under your mouth. I want you to open your mouth for me. Good. And now I'm going to close your eyes. I'm going to hit your head, face in a couple spots with this cotton ball. I want you to tell me when you feel it.
No. 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 No.
Great. Okay, cranial nerve number 5 is intact. So for 7, I want you to open your mouth. I'm going to have you taste something, and you tell me what it is, okay?
So.
Great. Can you smile for me? Frown. Raise your eyebrows. Puff out your cheeks. Good. Cranial nerve number 7 is intact. So the next test I'm going to perform is a whisper test. So I want you to hold your ear, occlude your ear in the vagus with one ear, with one hand, and I'm going to whisper 3 things in the opposite, and you tell me what they are, okay? So go ahead and close one of your ears. 1, 2, 3.
1, 2, 3.
Good.
ABC.
Great. Okay. Cranial nerve number 8 is intact. Next thing I want you to do is open your mouth. Say ah. Okay, great. Uvula rises and falls upon saying ah. Cranial nerve number 9 is intact. Next thing, please say light, tight, dynamite.
Light, tight, dynamite.
Okay, and you swallow for me? Good. Cranial nerve number 10 is intact. So the next thing I'm going to do is provide resistance against your face and your shoulders, and I want you to just push against it, okay? Good. Great. Awesome. Cranial nerve 11 is intact. Stick your tongue out at me. Side to side, up and down. Cranial nerve number 12 is intact. All right, so now I'm going to begin your actual head-to-toe assessment. Okay, so head is normocephalic, eyes and ears are symmetrical, nose and mouth are midline. Hair is sandy brown, blonde, no infestations, no sores or lesions upon examination. Okay. I'm going to look at your ears. Tell me if there's any pain or tenderness, okay?
No pain.
Okay, good. Okay, upon examination, there is no discharge, no sores or lesions surrounding the ear. I'm going to look inside your ear now. Tympanic membrane is pearly gray and kind of light reflective at 7 o'clock. No cerumen present. All right, there is no sores or lesions present upon examination of the right ear. no discharge. Tympanic membrane is pearly gray and kind of light reflective at 5 o'clock. All right, I'm gonna go to your eyes now. So your eyes are symmetrical once again. There are no sores or lesions surrounding the eyes. Eyebrows are good. The hair is intact and evenly distributed. Sclera is white. Blood vessels are present. Conjunctival sacs are pink and moist. All right, now I'm gonna look into your eyes. Test your white reflex, red reflex. Okay. Good. Red reflex present in both eyes. Now I'm going to palpate your nose and tell me if there's any pain or tenderness, okay?
No.
None? Good. Look up for me. All right. Nasal mucosa is intact, dry, and pink. Hair is evenly distributed and no secretions present. Can you occlude one of your nostrils for me and sniff? Other side. Good. No obstructions of both nares. I'm going to look at your lips and face now. Lips, once again, mouth is midline. Pink. Lips are pink and dry. Open smile for me. Teeth are straight and white. Okay, gums. Gums are pink and moist. No gingivitis or irritation present. Open up, say ah.
Ah.
Even though rises and falls. Palate looks good, intact, no sores or lesions. Buccal mucosa is pink and moist, no sores or lesions present, and no dental caries. Good. Okay. Now I'm going to palpate your trachea. Just look for me. Good. Trachea is midline, no deviation noted upon palpation. This way. Other way. Thyroid is non-palpable. Okay. So now I'm going to feel your temporal artery, okay? Good. Carotid. The other way. Good. All right, so now I'm going to auscultate the arteries for bruits. Good. Upon auscultation of both arteries, there are no bruits. And while I have here, can you tell me your name again?
Keith Williamson,
And what's today's year? What's the year?
2019.
Who's our president?
Donald Trump.
Where are you?
Southern.
Patience, alert, and oriented times 3. All right, so now I'm going to palpate your lymph nodes, okay? So we have preauricular, postauricular, jugulo-digastric, occipital, posterior cervical, superior cervical, deep cervical chain. Come up, we have submandibular, submental, and subclavicular. Okay. Was there any pain or tenderness there?
No.
No pain or tenderness noted upon palpation of the lymph nodes, and they're non-palpable. Okay, so give me your hands now. So once again, our upper extremities are warm and dry. There are hair is evenly distributed, no sores, lesions, edema present upon examination. Skin turgor is good, indicating no dehydration. And let's see, put your hands out like this. Push. Push, pull. Good. Upper extremity strength is a 5 out of 5. I want you to, we'll just range of motion, okay? Arm out, back in, all the way up, out, circle, other side. Good. Good range of motion in upper extremities. And now I'm going to feel your pulses up here, okay? Radial pulses are +2 bilaterally, brachial. Brachial pulses are +2 bilaterally as well. And I'm going to palpate your epitrochlear and lymph nodes. Okay, and they're non-palpable. Any pain or tenderness there?
No.
Good. All right, so now I'm going to examine your chest wall and your lungs, okay? So I'm just going to just feel around and palpate, and you tell me if there's any pain or tenderness. Any?
No.
Okay, good. Around the back. Any?
No.
Okay. Breathe in for me. Good. Breathe in. Good. No pain or tenderness upon palpation of the thoracic cavity, and maximum chest expansion reached upon respirating, and rib cage is midline. No abnormalities. All right, so now I'm going to palpate for tactile firmness, okay? So every time I touch your chest, I want you to say 99.
99, 99, 99, 99.
Good. I can do it.
99, 99, 99, 99, 99, 99.
Good. Upon palpation of tactile firmness, vibrations are heard in the anterior, posterior, and lateral aspects of the thoracic cavity. So one back here, I'm going to go ahead and percuss your ones, okay? Okay, upon percussion of the anterior, posterior, and lateral aspects of the chest wall, there is resonance heard. Okay, so now I'm going to auscultate your lungs, okay? That means just listening to them, just listen to your breath sounds. So every time I touch with my stethoscope, I want you to take a deep breath in and out, okay? Good. Again. Breath sounds are clear, bilateral, and equal in the anterior, posterior, and lateral aspects of the thoracic cavity. Alrighty, so now I'm going to have you lay down. I'm going to see your heart sounds. Alright, I'm raise your shirt for you, okay? So I'm going to listen to the 5 points of his heart. The first one is the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Okay. Now I'm going to turn this over and listen for heart murmurs. This is aortic, pulmonary, Erb's point, tricuspid, and mitral. Okay. The heart murmurs noted upon auscultation. Now I'm just going to feel your apical pulse, okay? Upon palpation, no lifts, heaves, or thrills noted. I'm going to listen to your apical pulse for 60 seconds so I can get your maximum impulse. upon auscultation. Pulse rate is 68 beats per minute, and the rhythm is regular. While I have my stethoscope, I'm going to go ahead and listen, check for pulsations, okay, of the aorta and the renal arteries. Okay, good, and I'm going to listen for vascular sounds while I'm here too. No vascular sounds heard upon auscultation. So, let's see. And S1 and S2 were heard. And, okay, now I'm going to examine your abdomen, okay? So, abdomen is flat, hair is evenly distributed, skin tone matches the rest of the body. There is a birthmark on the right upper quadrant. No sores or lesions present, no scars, and no swelling upon exam. So now I'm going to listen to your bowel sounds, okay? If there's any pattern, just let me know. Okay. Bowel sounds are active upon auscultation in all 4 quadrants. So now I'm going to percuss. Okay, tympany noted upon percussion of the abdomen in all 4 quadrants. And so while I'm here, I'm going to go ahead and check your capillary refill. It's less than 2 seconds bilaterally. Okay, so now I'm going to palpate lightly. If there's any pattern tenderness, let me know. This is just to examine if there's any masses present in the superficial area.
No. 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 No.
Okay, now I'm going to palpate a little deeper just to feel for any enlarged organs, okay?
No. No. No.
Okay, upon palpation of the abdomen, no swelling or masses noted in all 4 quadrants. So, alrighty, so upon examination of the legs, tell me if there's any pattern tenderness.
No.
None, okay. No pattern tenderness noted, no edema, no sores or scars or lesions present, no, like I said, no edema. Hair is evenly distributed. Skin tone is matching the rest of the body. Capillary refill is less than 2 seconds. I'm going to feel your pulses, okay? So popliteal. Popliteal pulses are +2 bilaterally. Now I'm going to do posterior tibial. Posterior tibial pulses are +2 bilaterally. This is dorsalis pedis. Dorsalis pedis pulses are +2 bilaterally as well. I want you to push against my hands, okay? Pull. Good. Lower extremity strength is 5 out of 5. Now I'm going to perform a Babinski test, okay? Reflex test. Okay. Negative result for Babinski reflex test. And now, let's see here. I'm going to examine for jugular vein distension. So can you look that way? Other side. Good. No distension of the jugular vein. Okay. You sit up on the side of the bed for me? I'm going to test your deep tendon reflexes, okay? Sorry. Good. Deep tendon reflexes are present bilaterally. Let's see here. Alright, I'm going to hand you something in your hand. Close your eyes and you tell me what it is, okay? Give me your hand. Okay, Good. Sterignosis is intact. Now I want you to have both your hands to me and close your eyes. I'm going to raise a finger. You tell me which one's up or down.
Up, down, up, down, up.
Good. Kinesthesia is intact. Now, I want you to stand up for me. Feet together, arms to your side, close your eyes. Okay. All right, patient has a negative result for the Romberg test. I want you to take 5 steps toward me, 1 foot in front of the other, okay? Good, back. Gait is strong, rhythmic, and balance is kept intact during the walk. So I want you to now take your heel of your foot and run it down your shin. Other side. Good. Cerebellar function is intact. Put both arms up. Touch your nose. Other side. Keep going faster. Good. Dexterity and cerebellar function is intact on the upper extremity as well. Now I want you to do like this right here. This is a deep knee bend. Okay, deep knee bend is strong, indicating good cerebellar function. And I want you now to kick your leg out. Just range of motion. Out, back, outer. Okay, good. Front, back, out, and around. All right, patient demonstrates good range of motion in the lower extremities. Can you bend over for me? Upon palpation of the spine, there is no curvature noted, indicating kyphosis or scoliosis. All right. I believe that concludes our head-to-toe assessment. Thank you.